So what we have here is a familiar slide of the pandemic to date, what we've seen in terms of hospitalizations, and particularly what we're looking at in the last month. So we've had 63 new people. We've had 706 new people admitted to hospital this week as of the 30th of January, the week ending the 30th of January, out of 11,539 new cases. As we can see from the blue line, it does look like we are at our peak of hospitalizations, and this is where we would expect to be, given the modeling that we've been using to help us understand the trajectory. The other thing that we look at, of course, is by age. Who is getting admitted in higher rates than others? And what we are seeing that it's coming down along all age groups. That bump up that we saw in the younger 0 to 19-year age group has leveled off and is also starting to come down. So when we look at who is in hospital, there's a number of important things to look at. One of them is what is the variant of concern that's causing hospitalization right now. So as we can see, it takes a bit of time for us to do the whole genome sequencing once somebody's been admitted to hospital to understand exactly what strain they have. But it's very clear that as we've progressed into January, Omicron has been more and more of the cause related to hospitalization, the strain related to hospitalization overtaking Delta. Although we still have people in hospital with Delta, people being admitted because of infections with Delta as well. If we look at the characterizations of people who are hospitalized, using this breakdown between Delta and Omicron, we can compare and see what the differences are in what we're seeing. And one of the important things we're seeing is that Delta, for the most part, was very strongly, hospitalization from Delta was much more common in people who were not vaccinated. Now with Omicron, the unvaccinated are a smaller proportion. And partly that's because some of the people, a good proportion of people in hospital, and I'll have that data to show you, are people who are admitted for other reasons and have a positive COVID test. So it's not COVID that's driving them into hospital. The median age is about the same, and I think this is something important. Early on, when we were trying to understand if Omicron causes more severe illness than Delta or not, we were seeing it more in younger people. So it was hard to tell if it was because people were younger and vaccinated or because it was milder in and of itself. We are now seeing that we're in that older age group that is requiring hospitalization. So that gives us some hint. We're also seeing that the proportion of people over age 80 is now higher, which gives us a sense as well about two things. One is people over age 80 are still at highest risk of having severe illness. This is something we've seen all along, whether they're vaccinated or not. We also know that people over age 80 are much more likely to have other underlying illnesses, which may be a reason why they are admitted to hospital and could be screened for COVID. The length of stay that we're seeing, which is really important in how we manage our hospital care right now, and the burden of people who are in hospital right now, particularly when we know that healthcare workers are off with illness themselves. So what we are seeing, thankfully, is that we continue to see a shorter length of stay, approximately half the time that people are in hospital with the Omicron compared to Delta. And so that does mean that people who have been admitted in December and January are still in hospital, and many more of those people would be from Delta that are in for a longer period of time. We also thankfully see a much smaller proportion of people requiring critical care. So that is either supplemental oxygen in the ICU or ventilation and other important interventions to keep the circulation and blood system going. And we are also thankfully seeing a much lower rate of death in people who are hospitalized, about half the rate now. So what does this mean overall? So if we look at our hospital admissions, and this is done from detailed chart reviews of 550 people across the province. So I had presented 2 weeks ago some very similar data that came out of Vancouver Coastal. We've now done the chart review of the 550 people who were admitted to hospital. So they're on admission. Some of those people are still in hospital today. Some of them would have been discharged by now. And this is across the province, and broken it down by people who were admitted to hospital because of COVID-19. So the reason for admission was because they had respiratory symptoms and or exacerbation of their underlying conditions because of COVID. And we see there's 218, about 40% of this chart review were people who were admitted because of COVID. And about 16% additionally required critical care. And over the period of time that we looked at in December and January, there were non-COVID-19 related admissions where the reason for admission was not related to COVID-19, but they had a positive COVID test, and that was about 244 or 44% of the cases. But when we look at this by breaking it down by the variant of concerns that we know are causing infections in hospital, we can see that for people with Delta, it is primarily people being admitted because of COVID-19, and a much higher proportion of those people are requiring critical care. And so that's important for us to know. This issue of people who are admitted to hospital with other diagnoses and test positive really is related to what we are seeing in the last few weeks as Omicron has spread so much in the community. And we can see that about 60% of admissions that were related to Omicron were not because of the infection, but people who were admitted and tested and found to have a positive test. So this is important. And for those that we don't yet have the whole genome sequencing, we see that the pattern, though those are more recent cases for the most part, the pattern is very similar to what we're seeing with Omicron. So that's telling us as Omicron has spread in the communities, we are more likely to pick it up when people are admitted to hospital for other reasons. And those other reasons are what keep them in hospital or require are reasons why they're in for a period of time. There is, of course, still unimportant, about 40% of people who are admissions because of COVID, because of their underlying illness, and a much smaller proportion compared to people who are admitted with Delta infection are people who require critical care. So obviously we want to see how that breaks down by vaccination status as well. And we can see again a different pattern for Delta than for what we see with the Omicron. So particularly as we were calling it, and it's so apparent when you look at this, that having at least one dose of vaccine, so this includes people who have 1 dose, 2 doses, or 3 doses. So any vaccine is very highly protective when you had Delta circulating in the community. And for people who are unvaccinated, you were much more likely to end up with needing hospital care, and we'll look at age in a minute, and a much higher proportion required critical care. So this is important. As we've moved to Omicron, we see that the incidental cases are much more common in people who are not vaccinated, people who have at least 1 dose of vaccine, and you're much less likely to be admitted because of COVID-related illness or to require critical care. And the pattern that we're seeing in those who we don't yet have the variant of concern is much more similar to Omicron. Again, it just shows us the importance and how we're getting through this phase of this pandemic with so much transmission of Omicron, how important it is that vaccination is preventing people from needing hospital care because of their COVID infection. The other part that we want to look at is, is this different by age? And the answer for that is, again, yes. So if you are admitted for COVID, you are much likely to be younger in Delta. So Delta is causing more severe infections in younger people, and as we've just seen, in younger people who are more likely to be unvaccinated. Whereas with Omicron, in younger people, it's much more likely to be an admission for something else where you had a positive screening test for COVID-19. And finally, just trying to put this all together and determine if Omicron itself is less virulent than Delta. We do see that seems to be the case with the data that we have that shows that if we match everybody and regardless of age, of vaccination status, of the other comorbidities you may have or other illnesses and sex and health authority, that there's about half as much chance of being hospitalized with Omicron. The odds of being hospitalized with Omicron are much less than with Delta. But importantly, 1.3% risk of hospitalization is still very high when you have thousands of people a day who are being infected. And we see from these data that it's incredibly important that the high levels of vaccination that we have in our communities across the board, across age groups, and across communities has made the difference in ensuring that our hospitals were not overwhelmed in this past few weeks. So what does this tell us? 90% of these new hospital admissions are Omicron, as I mentioned. People with Delta stay in hospital longer, are more likely to have severe illness, and the vast majority of those requiring care in hospital were a result in Delta were a result of actually from COVID. Today we have far more people in hospital than we've ever had. And many of those people, as much as 60 or 70% now, especially younger people, are there for other reasons and they've tested positive. And so what this tells us is this is really important. The level of immunity that we have in our community has protected our healthcare system at this most critical time, even when we've had the numbers of people who needed that hospital care. So while it is under severe strain, it is the credit of so many who have stepped up and got that protection that our hospitals are coping, even though we're stretched.